So, our today's topic will be on the sexual health among teenagers and young adults. This content also applies to college students. Topics that we will cover are going to be teen sexual activity, sexually transmitted infections, birth control, sexual education, and teen pregnancy. So let's begin with some statistics. When we look at sexual intercourse and sexual intimacy from 2015 among teenagers, and this includes everyone between the ages of 15 to 17, we see that 41% of teenagers have had experience with complete sexual intercourse or some form of sexual intimacy between the ages of 15 to 17. When we look at recent intercourse in the last 3 months, we see that 30% of them had sexual intercourse in the previous 3 months. And furthermore, specific details, 43% of that subpopulation group actually did not use a protective resource or a condom the last time they had sex. 14% did not use any method to prevent pregnancy or even any emergency contraception. 21% actually had alcohol in their body or utilized drugs before their last sexual intercourse. And then only 10% of sexually experienced teens have ever been tested for HIV, which is really surprising considering that the amount of knowledge that we have that has been disseminated through educational institutions, through public health agencies, through health clinics, departments, nonprofit departments, all of which are focused on HIV testing at an early age, especially for teens who are sexually active. And yet with all of these programs, we have a number as low as 10% that definitely needs to improve on a national basis. We are also going to look at why are the teen HIV testing numbers so low. It could also be perhaps due to a lack of a centralized mandatory testing program. We do not have one of those currently. And HIV testing is voluntary, so you can't make people get tested. I mean, it is encouraged. It is highly encouraged from all kinds of health avenues. However, it's not mandatory. And also we have to address the stigma that is associated with getting tested for HIV. So that really discourages people to get tested and thus decreases this number even further. We also have to look at, earlier when I was talking about not utilizing any kind of emergency contraception the last time teenagers had sex, one of the things that you have to really address is the low usage of emergency contraception, possibly due to its increased costs. So one common example would be Plan B, which is Plan B one step, which costs anywhere between $35 to $60 at a pharmacy, at any drugstore, at a grocery store to purchase, and that is the form of the most commonly used emergency contraception. Now, because of it's such a high cost, that definitely discourages teenagers to purchase that, and thus we do see a high rate of teenage pregnancy due to that. I also wanted to add some additional statistics and details about HIV/AIDS, but first and foremost, it's important to know that it is our responsibility to learn more about HIV and how to prevent it, to protect ourselves, our loved ones, friends. It is your responsibility to educate yourselves and other teenagers on the basics about HIV and AIDS, including information on how to protect themselves and others from it. Now, HIV can affect based on race, sexual orientation, but the truth is that anyone, regardless of sexual orientation, race, ethnicity, gender, or age, can contract the disease if they practice unsafe sex. There are certain groups that are at high risk based on their sexual orientation, gender, race, ethnicity, and age, and we're going to discuss those high-risk groups in just a second. But let's go ahead and look at some of these statistics here. So about 1.1 million people in the United States are currently living with HIV. And 1 in 7 actually don't know that they are infected. So this is a pretty high number, especially considering the population that we have in the United States. 1 in 7 people who are infected don't even know of their status. Alone in 2015, we had about close to 40,000 people that were newly diagnosed with HIV. And from those, 18,000 people are actually diagnosed with AIDS. Now, I want you to focus on the last statistics, and that is in 2015, 22% of all new HIV diagnoses were among youth aged 13 to 24. And that really tells you that this statistic is very applicable to the age group that we are discussing in our lecture and how it really impacts them. Especially considering the fact that, within the teenage years and the early or the young adulthood, that's where most of the new HIV cases occur. 22%. I mean, that's pretty close to a quarter of the new cases that occur each year that is in between this age group. So earlier I was talking about who is at high risk for HIV/AIDS, and I wanted to identify some of those high risk groups. But before I even talk about it, the borderline is that almost everyone who's engaged in unprotected sex is at risk for HIV/AIDS. However, we do have high risk groups. So following individuals are likely to be at high risk and should get tested at least once a year. Those are individuals who have or who may have more than one sexual partner. Those who have been diagnosed with other sexually transmitted disease or have a history of sexually transmitted disease. MSM is another category, men having sex with men, they should be tested as well. Or individuals who do abuse and inject drugs as well. So that kind of transitions us into our next topic, which is on unintended teen pregnancies. And just like with any other topic in teen sexual health, I wanted to start with statistics. First of all, I wanted to give you an idea of the number of babies that are born to women between the age group of 15 to 19. And again, this data is pretty recent. It's from 2015. We have about 230,000 babies, approximately 230,000 babies that are born each year to women between the ages of 15 and 19. Just like with every other birth rate or epidemiology rate, it puts us at a rate of cut. Just like with other health topics, I wanted to give you a per thousand rate for the unintended teen pregnancy birth rate as well. This puts us at a 22.3 births per thousand women in this age group. Teen pregnancy rates have been dropping, so that's a good thing. And the reasons for the declines are both. First of all, the first reason to address is that more teens are abstaining from sexual activity for longer periods of time, and they're waiting longer to initiate sexual intercourse. And number two, more teens who are sexually active are actually using some form of protection or birth control than they have utilized in previous years. So they're more educated about methods of birth control, what should be used, what should be not used. They're more aware of what they're comfortable with using and have practiced using, and thus that has contributed to this decline in the unintended teen pregnancy rates. I wanted to give you a pie chart that also talked about the drops in teen intercourse. So fewer teenagers age 15 to 19 are sexually active today than they were in the 1980s. Now this chart is from National Center for Health Statistics, and it looks at data from 1988 to 2011 to 2013. So it's comparing actually large amounts of data from a longer interval, so that's really good. We get to see more comprehensive data, and also this data is actually pretty recent, so it's about 5 years old, which is all right. Looking at both male and female, so within 1988, we see that about 60% of males were sexually active, and that number has decreased to 47% males within the years of 2011 and 2013. In females, 51% of females were sexually active between the ages of 15 to 19 in 1988. And when we look at the same age group, in 2011 and 2013, we see that that rate has also decreased to about. We also actually have comparison of how this rate further compared to data that was collected in 2014 as well. And there was a drop of 8% that occurred in 2014 for women between the ages of 15 to 17 years. And then birth rates also fell by 9% for women aged between the ages of 18 to 19 years. So in that sense, a lot of public health interventions that have been targeted on this youth, on the teenagers, have been working, and we definitely could continue those, strengthen those to make sure that they continue to decrease and reduce those numbers. Now, when we talk about teenage pregnancy, it is important to highlight why it's important to prevent teen pregnancy. And the most important reason is the substantial costs and the economic costs that are associated with unintended teen pregnancies. If we just look at the numbers, the cost is at least $9.4 billion as of 2010. And this cost, the number that we get is attributed, and the cost that we get is due to the following 4 factors. We have a loss of income among teen mothers because of having to stop their education, because of having to stop their part-time job, employment. We see that loss of tax revenue because of lower educational attainment. We see increased costs of healthcare and foster care, and then increased incarceration rates among children of teen parents as well. So also, furthermore, high school dropout rates among girls in comparison, when we look at those who gave birth during teenage years versus those who did not give birth during teenage years, how does the high school completion rate differ in both of those groups? And 50% of the girls who did give birth received a high school diploma by the age of 22. However, 90% of the girls who did not give birth during adolescence did graduate from high school on time. So that really allows you to see that giving birth during the teenage years does put completion of high school education at risk by about 50%. What are some of the risk factors for unintended teen pregnancies? So although all of these qualify, I did go ahead and create pointers to those two that are the biggest risk factors. So poverty, single parent family, home, cohabitation, parental education level are all major risk factors, but poverty and parental education level are two of the biggest risk factors that have impacted unintended pregnancies in teens. I also wanted to look at racial disparities in teenage pregnancies. So looking at, again, births per thousand in females aged 15 to 19 years. And this data is covering a time span from 2007 to 2017. You can see that this right here is the actual line of the overall birth rate. And then we have that data divided into birth rate for each specific race and ethnicity. So we have the non-Hispanic Black, Asian Pacific Islander, non-Hispanic White, American Indian, Alaskan Native, Hispanic group. And from the data, you can tell that the highest teenage pregnancy rate is amongst the Hispanic group at a birth rate of 75 per thousand, followed with African American at 62 per thousand, American Indian 50 per thousand, Caucasian 27 per thousand, and then the Asian and the Pacific Islander at about 15 per thousand. The declines in teen birth rates from 2014 to 2015, so I wanted to get specific birth rates from 2014 to 2015 and the amount of declines that we have seen. So these percentages that you see is a percentage of decline. So we've seen a 10% decline in teen birth rates in the Asian Pacific Islander group. We've seen a 9% decline for the non-Hispanic Black group. We've seen an 8% decline for the Hispanic group, 8% for non-Hispanic White, and then 6% for American Indian and Alaskan Native groups. So there has definitely been declines in all areas. But the teen birth rates, I also wanted to give you a little bit of comparisons in between each race and ethnicity. So for Hispanic teens, the birth rates were still more than 2 times higher than the rate for the non-Hispanic White teens. The birth rate of non-Hispanic Black teens was almost twice as high as the rate amongst the non-Hispanic White teens and the American Indian, Alaskan Native teens. So among the American Indian and the Alaskan Native teens, the birth rates actually remain more than 1.5 times higher than the non-Hispanic White teens' birth rate. You also have a geographic differences in teen birth rates and differences due to socioeconomic backgrounds that we're going to discuss. So let's look at geographic disparities first. First of all, I want to address that geographic disparities do exist, specifically within the southern and southwestern region. We do have high rate counties that are clustered, so counties where you do see high rates of teen births and unintended teen pregnancies. Now, teen birth rates are higher in rural counties than they are in urban areas and suburban counties, and that actually occurs regardless of race and or ethnicity. So that tells you that you do have geographic disparity that is of higher weight when we look at disparities compared to racial and ethnic disparities. In 2010, the teen birth rate in rural counties was nearly 1/3 higher than the rest of the country. So it really tells you that within 2 different areas, even looking at Texas, the rural areas versus the metropolitan areas, the teen birth rate differs quite a bit, and that could be due to lack of access to resources, health education centers, sex education and health education programs within the school districts, availability and access to birth control, knowledge of birth control amongst teens. So there are several factors that are involved that makes the geographic disparity is such a prevalent issue. and teen pregnancy. Now, the birth rate in rural counties have declined, but only by 32%. I say only 32% because when you compare that to other areas like the urban centers, it's declined by 49%, or in suburban counties, it's declined by 40%. You're able to see that rural counties, again, the decline rate was lower compared to other areas. Though a decline is good, and 32% is a significant amount of decline, the goal is for us to match it up to the urban and the suburban areas as well. Now, looking at this map right here, this is the U.S. teen birth rate of 2014 that puts us at a rate of 24.2 births. So if you look at the key, the states that are white, they have a teen birth rate of less than 20%, and we see Utah, Washington, Minnesota, Iowa, Wisconsin, and then some of the East Coast, many of the East Coast states that are in that category. The next category is the green one, where you see birth rates from 20 to 30%, 29.9%. So everything in the Midwest and everything surrounding California. We see some states right here, Florida, Georgia, South Carolina, North Carolina, that are all within that category. And then we have a handful of states that are in the blue category, which have a teen birth rate of 30 to 39.9%, Texas being one of those. So compared to the national teen birth rate, our state's teen birth rate is a lot higher. That brings us to the socioeconomic disparities. Socioeconomic disparities and conditions also exist, and when we look at socioeconomic disparities, we're looking at key concepts such as low education, families' low income levels, few opportunities in a teen's community for positive youth involvement. So what do I mean by that? Positive youth involvement basically are in these things, or these programs, initiatives are usually run through nonprofit organizations. So within the NACADHS community, we have our Boys and Girls Club. You may have the YMCA Center in some of the other areas, and all of those organizations really revolve around character building and positive youth involvement within the community. Not having access to those can also be detrimental for a teen growing up, because they don't really have an avenue where they can connect with other teenagers, have positive social and peer involvements and developments. Then we have our neighborhood. The neighborhood does have a definitive impact on the socioeconomic disparities, and it also has a definitive impact on teen birth rates, as we talked about a little bit of that in the geographic disparities. Although our content, when we talked about geographic disparities, was about rural, suburban, and urban counties, it is also applicable to the neighborhoods. There is a saying, and there's a documentary on YouTube that talks about, your zip code determining your destiny. The question is, to what extent is that true? Can income inequality really impact an individual where they don't have access to lack of good jobs, drowning local economy to the point where then they start to experience negative health outcomes? One of those being high rates of HIV, unintended teen pregnancies, and things of those sort. So neighborhood also has a definitive impact in developing socioeconomic disparities. I also wanted to add, when we talked about the low income levels of a teen's family, so teens in children's welfare systems, young women specifically that are living in foster care, are twice as likely to become pregnant between the ages of 15 to 19. So that's another example of families' living situation, income levels, opportunities for positive youth involvement. All of those play a role altogether to one health outcome, and in this case we're looking at unintended teen pregnancies. I found this bar graph, and it's really interesting because it compares socioeconomic conditions in counties with highest and lowest teen birth rates, and it looks at employment rates, average income, and education. So percentages of people who have an associate degree or higher. Now, if you look at the first graph, it's looking specifically at unemployment rate. The blue bar graph is the highest birth rate counties, and if you notice right here, that is also the graph that has a very high unemployment rate. The lowest birth counties, which are represented through the orange color, have lower numbers of unemployment. So we see a direct correlation between unemployment and unintended and teen birth rates. In areas, neighborhoods, families where you have lower rates of unemployment, we see lower rates of teen births. Then we have the percentages that are associated with percentages with associate degree or higher. We see that highest birth rate counties that are depicted through the gray color, so the gray graph or the gray bar, Those are the counties that also have individuals with less number of people who have higher degrees. So again, there is an inverse relationship between teen birth rates and receiving higher education. The lower the education, the higher the number of teen birth rates. The lowest birth rate counties, which is the yellow one, have a lot more individuals who have degrees, associate degrees or higher. So that means that again, there's an inverse relationship between teen birth rates and the number of individuals within the family or the household, the neighborhood with associate's degree or higher. The same thing with the average income. The higher the income, the lower the teen birth rates. The lower the income, the higher the teen birth rates. Over here, the higher the education, the lower the teen birth rates. Over here, the lower the education, the higher the teen birth rates. So on and so forth. I really like this graph, and I might have some very good exam questions, very good multiple choice questions specifically from this particular chart. So make sure you pay attention to that. Now, I also want to talk about taking action to eliminate disparities. Eliminating disparities in teen pregnancy and birth rates would require achieving health equity. And what exactly is this? I want to start with giving you a textbook definition of health equity, and that is when every individual has an equal opportunity to achieve the desired health outcomes by overcoming their social, geographic, racial disparities and barriers to health, whatever that they may be facing individually. And again, remember that those barriers are different for each individual, for each family, for each community. We also want to improve the life opportunities and the health outcomes for young people. So we want to have more involvements. We want to have more community projects and initiatives that really involve youth and allows them to interact with one another and have a deeper bond and connection with the community and the more improvement of the community via the youth's involvement. So lastly, efforts that focus on social determinants of health in teen pregnancy prevention efforts, particularly at a community level, play a critical role in addressing racial, ethnic, and geographical disparities that are observed in teen births in the U.S. So our goal is to achieve health equity throughout and to make sure that it's achieved equally for each family, for each individual, for each community. What communities can do to address disparities on their own: they can use their local data to better understand and prevent teen pregnancies of their own community. They can engage parents, teachers, community leaders, stakeholders, health leaders from nonprofit organizations, county health departments, local health departments, and pretty much everyone who's involved in that aspect with teenagers or with teen health outcomes to support and participate in teen pregnancy prevention efforts. And then utilizing all of those efforts to directing the proven prevention efforts and resources to areas with the greatest needs. So areas that are prevalent in unemployment, areas that are prevalent with low education rates, areas that are prevalent with low household income. Communities can do, again, furthermore to address disparities. They can provide teen pregnancy prevention programs to diverse teen populations. They can help each teen to understand how he or she can prevent unintended teen pregnancy. They can promote easy access to reproductive health programs and services that are respectful, culturally appropriate, and then teen-friendly as well. They can also establish diverse partnerships to address the social determinants of health that underlie high teen birth rates. So a couple of examples would be the Heartbeat Pregnancy Center. It's a faith-based pregnancy center that is located in Nacogdoches. We also can talk about the Planned Parenthood, which is located in Lufkin, and the idea of both of those nonprofit organizations is to encourage and to support teens in making healthier choices for their sexual health. We also need to make it very easy to talk. Unfortunately, the stigma, the barrier that is associated with talking about teen sexual health really prevents teens from approaching individuals and talking about these ideas, talking about wanting to know more about birth control, wanting to try different birth controls, what are they comfortable with, all of those ideas. So first of all, we need to make it easy to talk. It's important to understand that sexual development is a normal part of the teen years. Teens need our help in understanding their feelings, peer pressure, how to say no if they're not interested, how to handle a situation when they are interested, what are the options that they have, what are the having sex, educating them to prevent pregnancy and sexually transmitted disease. And if a teen wants to talk to their parents about sex and relationship, making sure that that is communicated to them ahead of time so that they know that remains an option. We also have to realize that parents have a strong impact on 18, which impacts if healthy decisions will be made down the road. Research shows that teens who talk with their parents about sex, relationship, birth control, and pregnancy, they begin to have sex at a later age. So they really wait for they really wait before they initiate sexual intercourse. They also use protection, form of condoms, birth control, more often when they have sex, and then they have better communication with their romantic partners. It's important to understand that sex is a natural human desire plus need, so not to make it a taboo topic for teenagers, and that's really where we can initiate having healthy talk, a healthy dialogue, a communication about this topic, and making it easier for teens to approach other individuals who have the knowledge on the topic, to then overall improve their health outcomes. Serves to be our last lecture for our course. If you have any questions, contact me via my SFA or through D2L.